Video is today on a condition known as athlete's foot. So, athlete's foot, also known as Tinea Pedis, is a fungal skin infection that usually begins between the toes. It commonly occurs in people whose feet have become very sweaty while confined within tight-fitting shoes. Signs and symptoms of athlete's foot include an itchy, scalish rash. This is contagious and can be spread via contaminated floors, towels, or clothing. Athlete's foot is closely related to other fungal infections such as ringworm and jock itch. It can be treated with antifungal medications when the infections come back. So it is caused by the same type of dermatotypes fungi that cause ringworm and jock itch. Damp socks and shoes in warm, humid conditions favour the organism's growth. Athlete's foot is contagious and can spread through contact from an infected person or from contact with contaminated surfaces. You can also spread it from foot to other parts of the body, especially if you scratch or pick the infected parts of your foot. You are at higher risk of athlete's foot if you frequently wear enclosed footwear, sweat heavily, share mats, rugs, bed linens, clothes, or shoes with someone who has a fungal infection. Walk barefoot in public areas where the infection can spread, such as locker rooms, saunas, swimming pools, communal baths, and showers. The athlete's foot infection can spread to the other warm, moist parts of the body. With regards to jock itch, this is often caused by the same fungus that results in athlete's foot. It's common for the infection to spread from the feet to the groin because the fungus can travel on the hands or towels. An athlete's foot can sometimes lead to bacterial infections. So symptoms of athlete foot. So scaly, peeling or cracked skin between the toes. Itchiness, especially right after taking shoes off and socks. Inflamed skin that can appear reddish, purplish, greyish depending on your skin colour. Burning or stinging, blisters and dry scaly skin on the bottom of the foot that extends up the side. Different types of athlete's foot. So you have the toe web infection, and this is the most common type. It typically affects the skin between your fourth toe and fifth toe. Your skin can change colour, crack, peel or flake. You have the most common type infection, which affects the bottom of your feet to your heels and the edges of your feet. Your feet may be sore for a few days, then the skins on the bottom of your feet thickens and cracks. In rare cases, your toenails may get infected. It can thicken, break into small pieces and fall out. Vesicular type infection. A vesicular type infection typically affects the bottoms of your feet, but it can appear anywhere on your feet. A vesicular type infection features bumps or fluid-filled blisters. Then you can have ulcerative infections, when ulcerative infection is the rarest type of athlete's foot. So open soles ulcers often appear between the toes. Open sores may also appear at the bottom of your feet. To prevent athlete's foot, you can do a number of things. Firstly, you can let your feet air out. When you can, wear sandals to let your feet air out as much as possible. Wash your feet daily. Use warm, soapy water and rinse and dry your feet thoroughly, especially between the toes. Apply a medicated foot powder such as Tinea, Gold Bond, others, or other medicated powder such as Loctiment, AF, Z-Swab, others if you're prone to athlete's foot. You can change your socks regularly, at least once a day, more often if your feet get really sweaty. Moisture wicking socks such as doors made from cotton help you keep your feet dried, and do nylon socks. You can alternate pairs of shoes, use different shoes from day to day. This gives your shoes time to dry after each use. You should also protect your feet in public places by wearing waterproof sandals or shoes around public pools, showers and locker rooms. And be aware of the risk factors for spreading the condition. If you live with others, don't share shoes or unwashed bedding and towels. Diagnosing athlete's foot. So your doctor can be able to diagnose it by simply looking at it. Some types of athlete's foot looks like dry skin or dermatitis. To help confirm the diagnosis and rule out other conditions, your doctor can take a skin scraping from the affected area for testing in a lab. A biopsy can also occur, which is removing a small piece of skin and testing in a lab. Several drops of potassium hydroxide solution are dissolved in skin cells, so only fungal cells are visible. If your athlete's foot doesn't respond to non-prescription products and self-care, you may need to see a doctor to get a prescription strength cream or ointment such as clotrimazole, iconazole, or cyclopirox. So if you have a more serious infection, your doctor can prescribe antifungal pills such as terbinafine or itraconazole, or you might need to have topical and oral medicine. You should keep your feet clean and dry and wash your feet twice a day and gently towel dry between the toes. While using an antifungal product, after washing and drying your feet, you should apply an antifungal product. The antifungal terbinafine has been shown to be very effective. Another option is clotrimazole. So you'll probably need to experiment to find a product and formulation for that your doctor can probably give to you. You would apply the product to the affected skin as directed twice a day until a week after the rash clears up. This can take up to 2 to 4 weeks to see a result. If the conditions comes back, you might need to start applying the product again. Home remedies can also be suggested, such as changing your socks regularly, as I said before, especially if your feet get really sweaty. Wear light ventilated footwear, so you should avoid shoes made of synthetic material such as vinyl or rubber. Wear sandals when possible to let your feet air out. Change your shoes from day to day. This gives your shoes time to dry after each use. Protect your feet in public places, as I mentioned before. Wear your waterproof sandals or shoes around the public pool, showers and locker rooms. And try not to scratch the rash. You can smooth your itchy feet by soaking them in cool water. Sorry, I said smoking there. Don't share the shoes. Sharing risks spreading this fungal infection. That's the end of today's video, so I hope you enjoyed that. So thanks very much for tuning in, and I hope to see you in the next one.